Dr. Tanmoy VAIDYA. Yeah. Capsular phimosis and retinitis pigmentosa, role of capsular tension ring, polishing and biomarker analysis.
A very good morning to everyone here. So I'm Dr. Tanmoy VAIDYA. I have no financial disclosures. So retinitis pigmentosa is a group of inherited retinal disorders having visually debilitating symptoms. But one of the most important factors here is the early onset posterior subcapsular cataract. And surgeries in these patients can be a blessing because their central vision can maybe restored as long as the macula is fine. But the only problem, the long-term post-operative side effects may be higher, and one of them is capsular phimosis. It is also proposed that zonular dehiscence in these patients and increased lens epithelial cell fibrosis may be the reason. And in these cases, it's early onset and it's very aggressive. We can see an image here where literally the lens has been crumpled up inside the bag itself. So we decided to conduct a study to assess the role of a capsular tension ring and anterior capsular polishing and to see if that prevents this capsular phimosis. And we also analyzed the levels of biomarkers in these patients. So we included patients having bilateral immature cataract, having retinitis pigmentosa. We excluded the complicated cataracts and any other ocular comorbidities. We conducted a prospective interventional study after the ethical committee approval. We recruited 20 patients, that is 40 eyes, having cataract with retinitis pigmentosa. After carrying out a detailed examination and the ancillary investigations, we performed the cataract surgery in the first eye with the capsular tension ring and the polishing, and the second eye without the intervention. And during the surgery, the aqueous humor was also collected. The follow-up of these patients was done after 6 months. So like I said, the aqueous humor was first collected before the cataract surgery, like during the cataract surgery. That was the first step we did. We also placed the CTR and the anterior capsular polishing was done in the first eye, and in the second eye it was not done. The assessment of this capsular phimosis was done after 6 months on a slit lamp examination, where we measured the diameter of the inner extent of the capsular phimosis and we calculated the area. So anterior capsular contraction or phimosis was considered when this diameter of either meridian was less than 3.5 millimeters, corresponding to an opening area of around 10 millimeters square. After doing this, the aqueous humor which we had collected, we sent for multiplex ELISA and we did flow cytometry, assessing the following biomarkers. Now what we saw was very interesting. After 6 months, only one patient showed significant capsular phimosis where we had actually done the intervention, whereas where we had not done any other intervention, 5 patients developed significant phimosis. And it was approaching statistical significance. One of the most important factors is understanding exactly why it is occurring. Now I would like to show the SLCAM1 factors here, which are grossly increased in retinitis pigmentosa. Now this is the same factor which is found in cystic fibrosis, that is in the lungs. And a lot of research has also been carried out in these areas. Along with that, the VCAM factor 1 and the granzyme was also increased. These are all the biomarkers which are found in systemic diseases like cystic fibrosis or even in other musculoskeletal disorders. We also saw a lot of factors decrease, like the protective factors like PDGF-A and PDGF-B. And along with that, perforins were also reduced, which are anti-fibrotic factors, along with the interferon beta. So, as I said, there's a synergistic environment which is created where the pro-fibrotic factors are increased significantly and the anti-fibrotic factors are reduced. This is what actually causes the aggressive capsular phimosis. Although this was not exactly one of the objectives of this study, but we also observed that in early RP changes, the capsular phimosis is not very aggressive. And in these same patients, we also incidentally saw the borderline values of these biomarkers. But with advanced cases, these factors, especially the pro-fibrotic factors, were increased. And in these patients, the phimosis was seen. So in conclusion, what was known is that there is early onset in cataract in RP. And also cataract surgery improves the quality of vision, but capsular phimosis is one of the factors which may cause an issue. What this adds is the CTR and capsular phimosis, capsular polishing may reduce the incidence of phimosis, and there is increase of pro-fibrotic factors and reduced anti-fibrotic factors, leading to its increased incidence. In the future, lot of targeted therapy which may be carried out. So already drugs are available which are there, like perfenadone, which is used in cystic fibrosis. We can use these in the future to prevent the capsular phimosis. Thank you.
Exactly in time. So one thing is, there are two things which I think is important. One is when you are measuring the anterior capsular phimosis, so you should also note down what was the rhexis margin initially.
Yes.
So that you know what is the deviation from that margin to this,
Yes.
rather than only the absolute value.
Yes, sir. I should have included this in the slide, but our study excluded the patients where the rhexis margin was less than 5 millimeters, and it was
Yes.
carried out by a single surgeon.
Yeah.
I should have included.
So you have to say that from 5 it went to 3 or whatever it is.
Yes.
The another point was that you have included both the things. One is anterior capsular polishing and one is insertion of CTR. So we don't know what was the main reason for decrease in that. So a good study would be, a better study would be to classify into 3 parts. One is only with capsular retention ring, one is with only polishing, and one would be with both, and you can increase the sample size for the same.
I feel, sir, only issue in these patients, like in these kinds of studies, that the number of RP
Sample size.
patients.
I know.
It's very difficult to get, so we
I
had
know.
to group it together.
Yeah.
Yes.
Okay. Thank you.
sir. Thank you.
Actually, since you have all these facilities available in your center, I think you can do a prospective study on patients who actually develop capsular phimosis, irrespective of whether they have pseudo-exfoliation or RP or whatever, and then see if there is a common factor amongst them.
One more thing which
With
we
all
have
the
seen
study that you have.
that earlier when we were using hydrophilic lenses, this capsular phimosis was much more as compared to the hydrophilic, because they are stiffer and stronger as compared to hydrophilic lenses.
Yes.
Thank you.
Thank you, sir.